Hello everyone, my name is Jenny Peters. As Director of Health of the ATDOE Memorial Foundation, one of my roles is to ensure that we have supplies needed in order for us to operate efficiently. Over the years, we have partnered with several organizations that has enabled us to provide free medications, basic first aid supplies, dental hygiene kits, girls' menstrual pads to our students during the school year and during our free community health fairs. We have partnered with the community, providing diabetes, high blood pressure, stroke prevention, STIs, education and prevention, malaria. This could not have been possible without our outstanding team. May I introduce our team. For the U.S. base, we have Eleanor Basilo, Director of Healthcare Education, Amanda Thomas, Director of Administration, Frances Yang, Director of Quality Compliance, Patience Wise Tijan, Officer in Charge, Liberia Base, Eric T. Weir, Quality and Clinical Coordinator. At this time, I would love for you to hear from our local residents, our students, how they have been impacted from our initiatives. And then also, I would love the opportunity to have you walk through the clinic with us.
I'm a student Vera Jimmy from ATDOE Memorial Academy, my 11th grade class.
Okay.
I have benefited a lot from the health club. Firstly, I was taught about knowing my menstruation cycle. If I see my menstruation, what should I do as a female to prevent myself from getting infection? And also how to use the sanitary pad. In the other time, our sponsor helped us with a sanitary pad. He helped us a lot. But there was other girls that don't know how to use it. And through that, some of us know how to change our pad regularly. And I'm so glad for that.
Why do you say important to have this health facility situated in this environment?
This clinic that is about to be open for this community in this school will be very much important and helpful to the school and even the community. Like the other time I came to school, I was feeling ill, and the nurse from the health club, she came and tested my blood. She said I was having malaria, and it helped me. And it will even help the community dwellers to help like children. Like at night, the child feels sick, and for here to go to the government hospital is very far. So it will help them. At least you can take a little walk, you will reach to the clinic, and you'll be able to help your child or children to feel well. There is such shame.
Okay. What benefit you had from the health fair?
The benefit I got, I know that I have pressure, but when the health team came here, when they check on me, they knew that I have pressure. They are taking the tablet, so I know myself that I'm a pressure patient.
I want to first bless God for this foundation, where I know about the foundation. We give free education and free health facility within this particular community.
Okay. I know you benefited from the health fair program.
Lot of things are benefited.
What can you say about that?
Yeah, first of all, I know that they know me to know my status because I'm a pressure patient. And I went there, they took my BP and my sugar test. They gave me some medical treatment. I took it, and well, I did a terrible thinking to improve my status. And I appealing to them to please help us to open our clinic because now no way for us to go to the hospital. And they hear my voice, we say thank you to them, to the donors, to thank you to the family, thank you at large. We say, please open our clinic. We're begging them. But it's very helpful to us. So we are begging them to open our clinic. Let our children, our students come to our clinic because it's no work for us now. So thank you so much.
My name is Eric T. Weir. I'm a nurse, a mental health clinician, and an addiction professional. Work with the Ministry of Health and the Mental Health Unit. I have been working with the ATDOE over 5 years now, being part of the health fair activities. If you listen carefully to some of the community dwellers, they already share with you their own testimonies. The health fair is important because it helps to allow people of the community know their health status, to be able to manage their health condition and take prevention measures that will help improve their lives. So the health fair is very important. Having such intervention like the clinic in this community will help save lives, because the distance between government hospital and the Sugarcane Farm a bit stressful. So having this clinic erected and operational, it will help many lives, save many lives that will have complications or minor medical issues that need intervention that will not allow them to go to government hospital. So this clinic will actually help to reduce the workload at government hospital and also promote healthy life for people within this community. So the need of the clinic is something that we cannot overemphasize. So we want to encourage other partners, donors, well-meaning Liberians who are listening to this or watching this video to understand that the ATDOE Foundation will need their support so this facility can start to be able to take care of the health needs of the people